Let's make diabetes easy to understand with animation. Normally, the pancreas releases insulin to help glucose enter cells. At its core, type 1 diabetes is an autoimmune condition. This means the body's own defense system, the immune system, which normally protects us from invaders like bacteria and viruses, makes a critical error. It mistakenly identifies a vital part of our own body as a threat. In this case of mistaken identity, the immune system's attack is focused on the beta cells. These are highly specialized cells located in clusters called islets within the pancreas. Their sole job is to produce insulin, a hormone essential for regulating our blood sugar. So why does this happen? The exact cause is still being researched, but it's believed to be a combination of genetic predisposition and an environmental trigger. Some people carry genes that make them more susceptible. Then, an environmental factor, possibly a common virus, may flip a switch, causing the immune system to launch its misguided attack. This destruction isn't instantaneous. It's a gradual process where immune cells, specifically T cells, eliminate the beta cells over months or years. During this time, the body may produce proteins called autoantibodies, which can be detected in the blood and serve as an early marker of the disease. Once a majority of beta cells, typically 80 to 90%, are gone, the pancreas can no longer produce enough insulin. Without insulin acting as the key to unlock our cells, glucose from food can't get in to provide energy. It remains trapped in the bloodstream, causing blood sugar levels to rise dangerously high. This is the defining characteristic of type 1 diabetes. Now let's turn our attention to type 2 diabetes, which accounts for the vast majority of cases. The fundamental process is different. To understand it, let's stick with our analogy. Insulin is the key, and your body's cells have doors that let in glucose for energy. In a healthy body, the key turns, the door opens, and energy flows in. In type 2, a problem called insulin resistance develops. Think of the locks on the cell doors becoming rusty or gummed up. The insulin key is there, but it has trouble turning. The cell just doesn't respond as it should. This resistance is often linked to genetics, but lifestyle factors like carrying excess weight and a lack of physical activity play a major role. The doors stay mostly closed, leaving glucose to pile up outside in the bloodstream. Sensing the high blood sugar, the pancreas goes into overdrive. It thinks, if one key isn't working well, let's send a whole flood of them. It ramps up production, pumping out more and more insulin to try and force those stubborn doors open. For a while, this compensation might work, keeping blood sugar levels in a pre-diabetic range. But this frantic pace isn't sustainable. Over years, the insulin-producing cells in the pancreas can become exhausted and wear out, like an overworked factory. Eventually, insulin production falls, creating a dual problem: resistant locks and fewer keys. This leads to chronically high blood sugar, which can damage the body over time. The good news is that this is not an inevitable decline. Lifestyle changes are powerful. By improving diet and increasing physical activity, you can essentially help clean the rust off those cellular locks, making them more sensitive to insulin again and taking a huge strain off the pancreas. Recognizing the signs of diabetes is the first step. The classic symptoms include frequent urination, as the body works overtime to flush out excess sugar. This directly leads to intense thirst as you try to rehydrate. You may also feel persistent, profound fatigue, because your cells are being starved of the glucose they need for energy, leaving you feeling drained no matter how much you rest. Other red flags can include unexplained weight loss, which is especially common in type 1, as the body breaks down fat and muscle for fuel. You might also experience increased hunger, blurred vision as high sugar levels affect the lenses of your eyes, or notice that cuts and sores are healing much more slowly. In type 2, these symptoms can be mild or develop gradually over many years, which is why they sometimes go unnoticed. Because the causes differ, so do the treatments. For type 1, where the body produces little to no insulin, treatment means lifelong insulin replacement. This is managed through multiple daily injections with a pen or syringe, or with a continuous insulin pump. It's a delicate balancing act, requiring careful monitoring to match insulin doses to food and physical activity. For type 2, the journey often begins with lifestyle changes. A healthy, balanced diet and regular exercise are the foundation, as they help the body use its own insulin more effectively and naturally lower blood sugar levels. If these aren't enough, oral medications are introduced. As type 2 can be a progressive condition, the pancreas may produce less insulin over time, making it necessary for some to eventually add insulin therapy to their management plan to maintain control and prevent long-term complications. In short, type 1 is immune loss of insulin. Type 2 is resistance plus overwork. Both raise blood glucose. Talk to your health provider for testing and care.